Right, good morning. We're joined today by Dr. Glenn Caley from Caley Chiropractic, and we're talking about chiropractic care and fertility. As you know, we're highlighting Reproductive Health Month during the month of February by chatting to fertility experts in their specific fields. And Dr. Glenn Caley is one of our esteemed guests. So I'd like to introduce him. And Dr. Caley, can you just tell us a little bit about yourself and how you progressed into the field of chiropractic care?
Sure. Hi, good morning as well. I'm one of those lucky people. I've been under chiropractic care since I was, I think, 8 or 9 years old. My mum was seeing a chiropractor at the time, and I had lots of knee pains growing up. And I always went home crying after sport that, no matter what I did, nothing got better. I remember seeing surgeons and specialists, and no one could kind of figure out what was going on. So I saw my mom's chiropractor, and I got adjusted, and that kind of got better, which was fine. You don't really care about that as an 8 or 9 year old. But as I continued through care, my asthma started getting better, my allergies started getting better, and I was fortunate enough to have a chiropractor then who understood chiropractic and what it does to the body and what its overall effects can be. And it was the philosophy of chiropractic that just the body doesn't need anything to be healthy. It just needs to be able to work the way that it should. That kind of sold me on it. So I knew what I wanted to be since I was about 13, 14 years old. So
that's awesome.
Fortunate in that way.
And you've recently moved to Cape Town, I believe, from the UK.
Yes, so born in Cape Town, and then I moved to the States for university. So I graduated in California, and then moved from there to Scotland and all around the UK. So yeah, finally home now after many years.
That's fantastic.
Yeah.
So I know at Caley Chiropractic you use the Gottstead system. Can you explain what this particular system is all about?
Sure. So the Gottstead system, it's just a very thorough full spine chiropractic approach. It's very old. A lot of people think it's kind of a new thing. And it prides itself on being very specific. So both in its analysis of the spine, but also how we correct the subluxation and how we actually go and make our adjustments. We're not a one size fits all. The majority of the time you're in the clinic, we're looking for the main problem as to what caused the nerve pressure and how the body's compensating from that. We never turn or twist and rotate the spine, so our adjustments go through the disc. So we're not compromising the disc or the spinal cord in that way. We use a little temperature device. In fact, I've got a little temperature device called the nervoscope, and it just looks at temperature differences on either side. So we're looking with an objective tool as to where there's inflammation, where there's blood vessel dilation, constriction. So, we're not just looking for a stuck bone. And for me, that's what kind of drew me toward this, is in that, if nerve pressure was as detrimental to our health as we know that it is, we're probably not walking around with 6 or 7 of these things all the time. And if you can just find the cause of it all, then and leave the compensatory areas alone, you're giving the body the best chance to be able to correct that long term.
Yeah, that's great. So obviously we're talking in the slant of infertility at the moment, which I know is one of your specialities in your field. And of course, with infertility comes an enormous amount of distress, and this is both emotionally and physically. How can chiropractic care assist with infertility on a physical and cellular level?
Sure. So first, I wouldn't say I'm necessarily an expert or expertise within infertility. It kind of just fell into my lap, where I was fortunate enough to have many patients who came in with all sorts of initial complaints, and just getting to know people or through the history, you find out they've been struggling to conceive for years, and with many of them being able to tie that back to how their structure of their body or their hormonal levels, because of the neurology around that, may have had that effect. And so through that, we've had fantastic results with it.
Correct.
But we're not necessarily looking for that. So on a cellular or emotional level?
Yeah, well, a sort of a physical level.
Yeah, I think fertility for me is just the perfect dance of everything needing to go right within the body at the right time. Actually, no, within 2 bodies at the right time, right? Mm-hmm. And I think from a structural point of view, the better your spine and pelvis is able to move, the healthier your environment's going to be. If you had to look at an X-ray of a female who's got a coil or an uterine device, you'd actually see as the pelvis rotates how this thing will migrate around, and you'd be amazed as to how far the womb and the cervix can move and does move when we don't have good motion and alignment within the lower back and the pelvis. So from a structural point of view, I think that tends to make sense to many people. But for me, the magic with chiropractic and fertility really lies within the hormonal levels. Your endocrine system and your hormone system is really what it's told what to do by the brain and the nervous system. Your brain is going to tell when to secrete something, how much of something to be secreted. And so the communication between the brain and the body now becomes very vital if we were looking to try and have the perfect amount of hormones and the correct hormones released at the specific time. So it's about having that good structural, happy environment and having your body's regulatory system being able to work at the right time.
Okay.
Or the best it can.
And then would you treat people if they were pregnant? I mean, have you seen patients before,
Yeah, while they're pregnant, yeah. I don't know if you want me to get to the treat thing now or a little bit later. So yeah, I can't stand the word treatment when it comes to chiropractic.
Oh yes, yeah, of course, yes. I know you don't. You talk about chiropractic care. I know this, and you
exactly.
don't.
Yeah, I'm stubborn and I'm pedantic, but there's a good reason that treatment exists, because if I'm coming in to have something treated, I'm looking to have that thing treatment. I need an ailment, right? Whereas firstly, infertility isn't an ailment, but chiropractic doesn't cure or treat anything specific, and that is just as true for infertility as it is for low back pain and sciatica. Chiropractic is making sure your brain and your body have good communication through the nervous system throughout, so your body can work the way that it should. The fantastic knock-on effects of that are, it's going to take away pain if the pain is coming from pressure from a nerve by a spinal disc, and the same would happen, if that nerve pressure is now going to a gland or an organ. But yes, I've always been blessed to see lots of pregnant mums, and I love it. It's a big part of my practice. It always has been. And the Gottstead system specifically is great for that because we have the objective tool of the scope. We're not lying someone on their tummy trying to just find stuck bones, which is great and works well for many people, but it's not what I wanted to do. So the specificity of being able to get pregnant ladies onto different benches, but also the fact that it's not a one-stop shop, one size fits all. It really is, where is the adjustment that's needed today? Is there even adjustment that's needed today? And I think both when you're looking to fall pregnant and when you are pregnant, that's vital. Your body's got so much going on. I don't want to come and overwhelm the body and the nervous system.
Of course.
I've had many people who come in and today your body's still adapting to our last adjustments, or there's too much going on. Let's give it a few more days, no adjustment, and come back later. We don't actually even charge for no adjustments in our office. It's very much we love and we do what we do, and the main point of coming in is to be checked. How is my body, my nervous system functioning? Do I need an adjustment? And go from there.
Okay, great, thank you. So we obviously know as well that infertility doesn't solely lie with women. Men can also be affected or contributed, should I say. Would you therefore recommend that men come in to maybe improve their fertility through chiropractic care?
Yeah, absolutely. I think you're right. It very much is a gender-based thing, isn't it? Things tend to lie with the woman so much more. And I think that's, even if you look at the research and the studies with it, because the outcome kind of needs to be pregnancy for the study, it's all the focus is on the woman. But yeah, it definitely needs to be both. And for men, it's the same thing. It's hugely, sperm count and fertility issues there's a lot of neurological research onto how that can affect sperm count. It's just looking at a completely different thing than is there a baby at the end. So without a doubt, men also tend to be slightly less open with those kind of things when you start to see them. So a guy coming in to see me with low back pain might take a few months before he starts to tell me about erectile issues or fertility issues. Whereas a lady, as soon as you're looking at an x-ray of them or chatting about it and chatting about where these nerves go and what they control, it kind of comes out a lot sooner. So we tend to find, or at least chat about the issues a lot sooner within care with females than males.
Okay, yes, I agree with that. So what are the long-term benefits for regular chiropractic care, especially for someone who's trying or looking to fall pregnant at some point?
I think the biggest thing with chiropractic is it helps homeostasis in your body. It's a level of balance, right? Your body should be able to always adapt to whatever's happening, right? If it needs to go into a stress response, it needs to go into a stress response. But if it's not in that stressful environment, it needs to be able to switch into, your parasympathetic and your rest and digest. And so our body should be able to kind of ebb and flow depending on our environments all the time. And for me, that's one of the biggest things with chiropractic care is you just have a body that functions and is able to adapt to whatever's going on better all the time, which is what really now starts to prevent all the bigger ailments down the road, because you aren't sitting with a stressful state and all the severe health issues that ends up in when it's like that for a long period of time. And specifically for fertility, because again, your hormonal state needs to really primarily be in a parasympathetic rest and digest, right? And that's why it's so important for people who are pregnant to have a nice relaxing pregnancy, so your body can really be in that healing state. And I think the biggest thing, remember at the beginning we spoke about the structure of the spine and the pelvis, and then the hormonal aspect of it. I think that's the biggest thing. If you have a body that's more relaxed and more adaptive, yes, there are many other reasons for infertility, but if you've got a body that's able to at least regulate itself as best that it can, I think you're giving yourself the best shot. You're putting yourself on at least the best front foot from there.
Absolutely, I agree. How many sessions, I know that this is probably a broad question, but how many sessions would you normally recommend to a patient struggling with infertility? What is your process, after the assessment stage?
Sure, I was going to say, because I wouldn't recommend anything at the beginning because I've got no idea.
Of course.
And again, that's for infertility the same as someone with a sore neck. And one thing about the Gottstead system is we don't do long-term care plans. You're not going to sit in front of me and get, right, for the first 3 months, I'm going to see you this much, because again, depending what I see with you on that day, and that might depend on what we've seen in an x-ray, if we have an x-ray of you, how much degeneration is there, what's happening within the health of the joint, what your day-to-day activities like. As a CEO who's there with high stress all the time is going to have very different types of stresses to a single mum with 3 kids running around all the time. Different types of stress, your body's going to react and be able to heal differently. So after the initial assessment, we'd have a chat and say, right, this is where I think you're at, and this is where I'd be hoping your body might be able to adapt, and what it might be able to achieve. The next time I see the person is probably the most important visit, because now I can sit down and say, right, we've given you one adjustment, and I would only ever do one adjustment, even if I found 2 or 3, within the spine on the first visit, because I want to see how the body's able to adapt from that. And that really tells us a lot more, because cool, we made an adjustment to your right side of your pelvis. Suddenly your neck's moving a lot better on the left-hand side. Great, your body's going to be far more adaptive. Whereas someone else might come in, same adjustment in the lower back, now the right side's more tight. Okay, we've got some compensatory issues going on.
Yes.
All chiropractors tend to see you a little bit more often at the beginning, mainly because you're trying to make a neurological change and you've got neuroplasticity and your body's used to working in a certain way. And for me, primarily seeing you more often at the beginning doesn't necessarily mean adjusting you more, right? I might look at you, right, you've got a lot going on this week. Your body's still adapting. Let's give it a few more days. But you tend to see them more at the beginning, and that would taper out, depending completely on what I find on the person in front of me.
Okay, great. Thank you.
Long-winded answer to.
No. It's actually, I'm learning. I'm loving it. That's all good. Other than your chiropractic clinic, obviously, and on your website, I see that you're an avid philanthropist. Can you tell us what causes you're involved in at the moment?
Sure. I mean, philanthropy is a nice word to call it. I wish I was that avid. I love it. That's one of the main reasons why I came home. I think South Africa and Africa is something that if you want to be here, it gets into your blood. And I wanted to come home and be able to do something within South Africa and within the community with the skills that I've got, right? And so I wanted to come back and somehow be able to get involved with chiropractic and helping South Africans be healthier human beings through chiropractic. And I was very fortunate enough to come across a nonprofit called the Justice Desk very early, who is run by a phenomenal human being. And it's more a human rights organization rather than a charity.
Okay.
Based on 4 main pillars, which is you've got human rights, children's rights, human trafficking, and gender-based violence. The 4 things that it's really based on. And for me, it was a lot of these underlying issues are the real underlying issues within South Africa that now spread to many of the crime and everything else the effects. And so I loved it because it was the chiropractic of charities, because it's looking at many of the causes. And so I'm involved with them, really trying to find a way to be able to take the pressure of the nervous system and add in the adaptability and post-stress of what many of the affected South Africans will be going through, whether it's girls within the community as well as the counselors and the actual sort of volunteers within the charity itself.
Love that, really do. And so if patients wanted to donate to your incredible causes, where can they find your details? I know they're on your website, so if you could give us details of your website or... Sure.
I mean, my website is caleychiropractic.com. The nonprofit is called the Justice Desk. So you can go straight to their website. There's no way of donating specifically from mine. Mine would take you to theirs anyway.
Okay.
And then there's a host of different things you can do for them. Obviously, like any nonprofit, financial aid is the biggest thing. I was actually chatting to the owner not very long ago as well, and how difficult that is to come across, because how many hurdles there are. And I was also amazed to understand how much of the donations that they rely on are actually international, which I suppose makes sense with exchange rates, but it's also a little bit disheartening when such a great South African cause is kind of being held up by international investments too. There's a lot they're wanting to try and achieve and do once they can get more money. But there's, like any other organization, there's a lot you can do just from, if you don't have the money to help, to be many specific other ways that I'm sure they'll be able to point you in the right direction.
Yeah, because that's one of Hart's main sort of ethos as well, as, philanthropy and local, within our communities, to try and help as much as we can.
Yeah.
So we've been getting sorry to interrupt.
No, so we all can do our little part.
Yeah, absolutely. Thank you. So we're getting a few questions on Facebook. Anastasia Naidu wants to know how you work with patients who have endometriosis or blocked tubes. It's not,
No, absolutely. No, my kind of thought process here is I think a lot of people might get frustrated that my answer might be quite repetitive. It literally would be the same way I would look at anyone else initially, right? So, which in a way is great as well. I think a lot of people who are going through any of these long-term issues, call them, are so used to going to so many different doctors, and they put into boxes, and that's fine. That's how medicine works. And you have this X diagnosis, this is how we're going to work with it. That a lot of people feel it very refreshing to come in, and I'm just looking at you as a person and a nervous system. So let's start there. Certainly those things are very important, right? So once we've found where there is nerve irritation and where we're looking at how the body is compensating for that, does it look like what I do might be able to affect and help what you're dealing with, right? Can we link any of the neurological issues together? Are we looking at any nerve irritation that might be locally affecting certain tissue, but might also be affecting hormonal changes, et cetera. And the important part about that is very much also going back within someone's history as to where this could have actually started. Not when's the first person they found a symptom, but where could this have started at the beginning? And again, then trying to maybe help find a cause of where it may be coming from.
Yes. But that's why I believe Hart believes as well, the chiropractic care is quite a nice complementary care system that, alongside their medical treatments, receiving, your care on the chiropractic side would actually benefit them in huge
because
ways.
I only do chiropractic, right? So I don't do any massage or needling or anything else. Not that there's anything wrong with that stuff. It's fantastic. But because I only do what I do, I always work very closely with other doctors and practitioners, because I'm not stepping on someone else's toes, right?
Yeah,
I'm not,
absolutely.
perfect example, someone with endometriosis, I'm not going to be there sticking my fingers and thumbs into your belly and trying to find out where is sore, because I can absolutely assume your medical doctor who's done that is good at their job and they've done everything they need to do there.
Yeah.
And they're much better at that than I am anyway. So
Yeah.
I've been looking at something from a completely different angle, literally because of that. But
Okay. So some Feroza Brenner's just asked, do you help with low AMH?
It'll be the similar type of an answer. So when you're looking at any form of hormonal imbalances, yes, it comes down to why it's low in the first place. Why is the gland struggling, right? Why isn't the gland secreting something? Is the gland not able to function properly for a reason, or is there actually something wrong with the specific gland? And looking at something wrong with the specific gland is very much a medical thing. So if there are no diagnoses there, what we can look at is, well, why isn't this gland doing what it should be doing?
Okay.
Makes sense?
Yeah, it does. So all I want to know basically is if you've got any final comments or words of encouragement for our patients.
I mean, one of my biggest things I also found with infertility, and this, I by no means want to play it down, because it's an extremely serious issue for many people and causes so much stress within families, is you hear stories, but I've also seen it in front of my eyes of people who can't fall pregnant and suddenly end up getting divorced or going different ways and then both falling pregnant. I mean, there's so often nothing wrong with the actual individuals themselves. I'm not saying the partnership isn't good. What I mean is sometimes the stress of falling pregnant is the biggest thing that's just stopping you from falling pregnant. And I understand that's such an easy thing for a male who has a child to sit here and say, so I'm not playing it down. But I just think sometimes people need to get themselves a little bit of a break first, and maybe look at, just from an emotional point of view, where it's all coming from. Is there any specific holdups that might be, for why the rush, or where the emotional holdup might be? Not saying that there is one, but it's certainly something that's not spoken about enough, I think, within the infertility realm.
Definitely, it's one of our
maybe sort that out. Definitely is one of the things completely.
It's one of our things that we advocate, is sort of breaking the silence of that, because there could be many reasons why somebody might be infertile. But these I don't want to call them alternative practices, but holistic practices and chiropractic care are very important alongside the fertility journey and your IVF treatment, and they benefit in every way.
Yeah, I think anything they can do, if there's something that, even if it sounds completely left field and out there, if there's something that makes mum and dad feel more relaxed and at ease, that can only benefit a fertility journey.
Definitely. So Dr. Caley, how can people get a hold of you? I know that we're actually going to create a link for our YouTube channel and for yours with all of your details, but how can somebody make an appointment to come see you?
A phone call or WhatsApp's usually the easiest, so I'm assuming you'll be posting the number for that.
Yes,
you can make one through our website, which, as I say, is caleychiropractic.com. Or emailing us, which I'm sure you'll post as well.
I shall.
And also questions. I mean, I'm more than happy to. There's a reason why our clinic number is a cell phone, right? It's because WhatsApp just becomes, or messaging becomes very easy from that point of view. So if someone contacts me, you're not going to get, well, I'll tell you when you come in and see me on your first consultation. I understand that bridging the gap between chiropractic and infertility is massive. So if someone has questions, absolutely give me a call, send a WhatsApp, and let's have a chat. And whatever I can say without meeting you, I'm more than happy to give any advice, or at least give more information that maybe I haven't been able to give in this chat.
That's lovely. And then you've got a Facebook page, right?
We've got Facebook and Instagram. Instagram's probably a little more, I suppose, updated. I'm not the best millennial. I'm not a millennial. So I try my best on that. But yes, there's a lot of tidbits of just my thoughts, or different little bits of education and information that I think might be able to help people.
Okay, great. Well, we've actually added your Facebook handle. So if anyone wants to reach you through that would be great. But it's been really awesome chatting to you. And thank you for taking the time out. I know you're so busy. So we appreciate your time.
It's an absolute pleasure.
Great. And we hope you have a lovely day.
Thanks so much. You too.
Okay. Thank you. Ciao.
Bye.